Hello everyone, my name is Kaylee Tobin, and today I'll be talking about alcohol and liver cancer, but more specifically how alcohol can lead to alcoholism, which can eventually lead to liver cancer. For my introduction, I have what is alcohol, what is liver cancer, how are these two variables connected, a look into the liver, study 1, 2, and 3, the graphic analysis of each study, and then each conclusion to follow the study. Then lastly, I have my final thoughts and my resources. What is alcohol? Alcohol is an ingredient in spirits, wine, and beers that make you intoxicated. The ingredient is ethanol, which is made from yeast, ferments, and sugars in fruits, grains, and vegetables. Alcohol is an organic compound that has one hydroxyl group bonded to a saturated carbon. Alcohol consumption can be addicting and can lead to alcoholism. Alcoholism is a disease that occurs when someone becomes dependent on drinking large amounts of alcohol that their body needs to have without having withdrawals. Everyone's body is affected differently by alcohol consumption depending on their sex, weight, and past medical history. What is liver cancer? Liver cancer is a life-threatening illness and one of the fastest growing cancers in the United States. There are several different ways you can get liver cancer, but one of the most prone ones is from alcohol misuse. One of the most common forms of liver cancer that is associated with alcohol is hepatocellular carcinoma. This cancer is common in people with long-term liver diseases, especially alcoholics. Alcoholics are harming their liver every time they have an alcoholic beverage, meaning they have a higher chance of getting hepatocellular carcinoma in the future. Overall, drinking alcohol can cause scarring in the liver, chronic liver damage, increasing the risk of cancers and other health issues. How are these two variables connected? Alcohol and liver cancer are connected together because extreme amounts of alcohol intake causes liver cancer. Alcohol liver disease reduces the liver's availability to filter blood through the body. Staying healthy and maintaining your body can overall help decrease the risk for alcohol liver cancer. Some ways to help reduce the risk of alcohol consumption is exercising regularly, eating healthy, avoiding tobacco products, and maintaining a healthy weight. A look into the liver. A healthy liver and a cancerous liver have many differences in using structure, function, and appearance. A liver that is in good, healthy usually has a reddish-brown color and a smooth texture. It is made up of blue blood arteries and connective tissue, bile ducts, etc. An unhealthy liver has visible tumors and the surrounding tissues can be infected. These tumors may cause the liver's natural structure to be distorted and come to a range of sizes. A healthy liver is an essential for several processes such as detoxification, nutrition, metabolism, bile generation for digestion, glycogen storage, and protein synthesis. Cancer can affect how well the liver functions. Tumor growth can repair liver function, resulting in symptoms like yellow of the skin and eyes, exhaustion, change in appetite, and weight loss. During an ultrasound or MRI, a healthy liver shows up as a smooth and free of apparent masses or abnormalities. An unhealthy liver can be tested by images testing and typically has tumors and aberrant tissue growth. Exploring patients with alcohol-related liver disease in Denmark. This study was a human clinical study observed in Denmark in 2023. The study was aimed to see if patients being diagnosed with alcohol-related liver disease would die within 15 years of being diagnosed. A large number of people do not get the proper care they need after being diagnosed, so they died from liver failure. The study was further looked into by looking at different ages, sexes, and other health concerns and other alcohol-related diseases. After being diagnosed with liver cancer for 5 years, half of the cases studied within those 5 years and percentage of death increased after being diagnosed. Overall, liver cancer can cause serious death within years of being diagnosed from alcoholism. When the case was studied, 532 people had followed up, and 67% of the patients had died due to the liver disease. The 5-year risk of death due to the liver disease increased 25.8% within those first few years. After 5 years of being diagnosed, you are likely to get cardiovascular disease, alcohol use disorder, and other cancers. Hepatocellular carcinoma is the number one cause of death, which is then followed by lung cancer. Overall, the final facts of the study have shown how important it is to get help once diagnosed, so you do not develop other illness and death. The conclusion for this study is stating, regardless of age or gender, patients with alcohol-related liver disease have significant chance of passing away from the condition many years after diagnosis. Hepatocellular carcinoma was one of the causes of cancer, which was then followed by lung cancer. However, this contributed to a small amount of death rates from patients with alcohol-related liver disease. Exploring alcoholic liver disease and the utility of animal models. This study is an animal study done in 2018 observing rodent models while mimicking human ADL, which is alcohol liver disease. Within the past decade, there has been numerous rodent studies involving alcohol exposure and the original progression of ADL. In this study, ADLD can be advanced and then replicated in the current animal model of ALD. For humans, within 10 years of being diagnosed, 20 to 40% of heavy drinkers tend to develop ADL with alcoholic habits. It is important to test ADL treatments on these other than humans like rodents to be able to learn how ADL can affect bodies differently involving alcohol. While these case studies did the experiments in rats, mice over the span of certain amounts of weeks, the study stated what type of feeding was done, what type of alcohol that the rodent's body consumed. The study also stated the advantages and disadvantages of the experience and what was difficult and what was easy to do during this experiment. Model, which was a primarily restrictive rodent natural aversion, demonstrated liver disease followed by alcohol delivery. After a considerable amount of alcohol was influenced, the TF model effectively increased liver damage by allowing more control over ethanol intake. However, even with prolonged feeding, the primary alteration in rodents followed by ethanol-only administration across models is limited to hepatic steatosis. In the future, an ideal model of ADL in rodents would mimic each stage in how alcohol affects the human liver. Rodent models have been important to when experimenting with ADL, even though there are differences between rats, mice, and human livers. Exploring alcohol misuse with alcohol-related liver disease. The study is a 2022 human clinical study which stated that the liver damage can affect your body even if you have ARLD, alcohol-related liver disease. It can still be just as bad as ADL, alcohol liver disease. During this experiment, search techniques related to ARLD and the psychological factors that can affect alcohol reduction. In the study, qualitative interviews with ARLD patients across research revealed common themes about treatment barriers, such as inadequate communication between the clinical team and the patients' lack of recognition of their own symptoms, and patients felt lost about and out of control over the illness. Lastly, treatment and proper care can help people struggling with alcohol misuse and prevent them from getting too extreme. The diagram explains that 1,145 records were identified and 150 articles underwent a double-check screening with 35 meeting inclusion criteria. Reducing alcohol use in patients in RLD is the pivotal strategy to reduce long-term alcohol-related harm. Reconfiguring alcohol services can help supporting patients with ARLD to enhance their engagement and improve their long-term outcomes. Final thoughts. Having self-control moderation when consuming alcohol is okay for your body and will not cause your body to be at an even greater risk of alcohol liver damage. In college, many students have access to alcohol and consume it very often, which is harming their livers at a very young age. Many students are considered alcoholics in college because of how often they drink and how much they drink. Students will go to parties, fraternities, and in bars on the weekends to drink with their friends and have a good time. However, this is becoming more and more of a concern because students are potentially causing health issues they do not need at such a young age. It is important to educate not only teenagers, but others as well on the harmful effects of drinking to help prevent even more concerning issues in the future. Lastly, patients who are diagnosed with alcoholism and do not get the correct help they need within the first few years are likely to be diagnosed and will end up dying due to liver failure. These are the sources I use. Thank you.